what happens when you or your dear ones test positive for corona. There is a lot of confusion what to do next, what is expected out of the situation. Several thoughts starts passing through one's mind, causing fear, anxiety and confusion. In such situation, it is most important to remember that most of the people who contact COVID-19 illness recover. So don't panic, stay cool and calm and manage the situation properly. After confirmation, first thing one should do is to consult the doctor. Based on your symptom, they decide whether your symptoms are mild, moderate or severe. If your case is evaluated as mild by the doctor, then doctor will advise you to stay at home. These cases can be cured at home and does not require hospitalization. Doctor recommends home isolation and care in such cases. Hospitalization is required only for moderate to severe disease. When in home isolation, certain procedures need to be followed for safety of patient and other members of the family. Patient should be isolated in a separate room with a separate bathroom that is not used by other family members. Patient's room should be well ventilated. If possible, keep the windows open. Patient should relax and take rest as much as possible. When the patient is awake, he can keep his mind occupied by watching TV, talking on phone or video calls with friends and family. If the patient feels like, he can also do mild exercises like walking for a few minutes in the room or any other form of mild exercise. It's important that an attendant or caregiver should be available to the patient on 24/7 basis. It is important that attendant or caregiver should wear triple layered double mask and gloves when attending the patient. Whenever patient's room door has to be opened, his face should be covered properly with triple layered double mask. It should also be taken care that those entering patient's room should also wear the triple layered double mask. Mask should be changed after 8 hours or if it gets wet or soiled. Dispose the mask safely. Patient should clean his body by sponging. Use warm water for sponging. Avoid cold water. Patient should wash his hand frequently either with soap or sanitizer. It is important patient cleans his room properly with disinfectant or soap. Patient should drink lots of water and keep himself hydrated. Patient should have healthy, nutritious and light food. He should do so even if he has lost his taste, as it is required for keeping him strong. That will help him in his faster recovery. Utensils used by patient should be washed with soap or detergent and water while wearing the gloves. Patient's personal items should never be shared with any other person in the family. Patient should monitor his oxygen level every 6 hours. Frequency can be increased if patient's breath is faster or is feeling breathless. Then measure oxygen level once and then walk for 6 minutes and then take the reading again. It is required to measure patient's temperature every 6 hours. If patient is having high fever, or then frequency of measuring temperature can be increased. Take doctor's advice regarding any change in your symptoms. Doctor will evaluate the symptoms and advise whether you can continue to stay in home isolation or need to go to hospital. When in home isolation, take medication according to doctor's prescription. Seek emergency medical attention when following symptoms develop in home isolation. Difficulty in breathing. Oxygen level shows less than 94%. High grade fever 101 Fahrenheit or above, or severe cough lasting for more than 5 days. Lips and face turns bluish. Feeling of disorientation increases. Or if there is persistent pain or pressure in the chest, there is slurred speech or seizures, or if patient is unable to wake up or stay awake. What should one not do in home isolation? Do not self-medicate. Don't believe and follow unscientific home remedies as a cure to your symptom. Until cure of COVID-19 is found, keep yourself safe from the disease by wearing proper mask, frequently washing hands, and maintaining social distancing. And most important is getting vaccinated as you get the opportunity to do so.